morning everyone. I am Dr. Shamoli Saha, Senior Lecturer, Bashundhara Ad-din Medical College. Today I will discuss about gastroenteritis. What is gastroenteritis? It is a condition triggered by the infection and inflammation of the digestive system. What are the factors responsible for gastroenteritis? There are several factors like virus, bacteria, parasite, bacterial toxin, chemical and medication. What are the viruses are responsible for the gastroenteritis? Mainly viral gastroenteritis. Norovirus, rotavirus, adenovirus, calici and astrovirus. Bacteria and bacterial toxins are also responsible for gastroenteritis like Campylobacter bacterium, Salmonella, enterotoxin, Shiga toxin and cholera toxin. What are the parasites? Entamoeba histolytica, Giardia lamblia and Cryptosporidium. Some chemical and drugs like lead poisoning and some antibiotic are also responsible for gastroenteritis. Today I will mainly focus about viral gastroenteritis. Norovirus, rotavirus, poliovirus, Coxsackie virus and ecovirus. These 5 viruses are mainly responsible for viral gastroenteritis. The calicivirus family, reovirus family and picornavirus family are the main family of the viruses are causes gastroenteritis. All are single stranded RNA virus except rotavirus. This is a double stranded RNA virus has 11 segmented genome. All are icosahedral in shape. They have no envelope and all virus have 2 or more serotype. Worldwide, viral gastroenteritis is the second leading cause of death under 5 children. Global estimation showed approximately 2.5 million under 5 children were developed diarrhea. Among them, 3/4 are mainly caused by virus. Viral gastroenteritis is the second most viral illness after upper respiratory tract infection in developed countries. Recently, CDC surveillance data showed norovirus outbreak occurred in Texas and Canada from August 2022 to January 2023. Now, what are the causative agents of the viral gastroenteritis? For the infant and young children, rotavirus, enterovirus, mainly enteric adenovirus group F, serotype 40 and 41, as well as astrovirus and small round viruses. Older children, adolescent and adult are mainly infected by the norovirus, mainly human calicivirus. Now today we will discuss about the rotavirus. Rotavirus first identified in the duodenal biopsy in 1973 by a Australian virologist Ruth Bishop. What are the properties? It is a medium sized non-enveloped icosahedral virus, double layer capsid and wheel like appearance under electron microscope. Its genome has 11 segmented RNA and each segment encode 1 or more non-structural and structural protein. The virion contain RNA dependent RNA polymerase. That is why the replication of the rotavirus occur in the cell cytoplasm. There are at least 6 serotypes for the human rotavirus. The outer surface protein called viral hemagglutinin is the type specific antigen and elicit the protective antibody, What are the outstanding characteristics of the rotavirus? The genetic reassortment occurs readily. The genetic reassortment occurs mainly due to 11 segment genome. Another one is, it is the major cause of infantile diarrhea. What is the pathogenesis? Before going to the elaborate pathogenesis, we should focus on the transmission. It is mainly transmitted by fecal-oral route, excretion by asymptomatic person. Nosocomial infection mainly occurred in the children. It is relatively acid level, that is why it is also called the stomach flu. Infective dose 10 to 100 PFU. The children got immunity from intestinal immunoglobulin A and colostrum immunoglobulin, which protect the newborn up to 6 months of the age. By the age of 6 years, most of the children have antibody at least one serotype of the rotavirus. Rotavirus bind with the small intestinal beta adrenergic receptor and replicate within the villi of the small intestine. They multiply in the enterocyte and destroy the enterocyte and damage the intestinal transportal mechanism. It secrete NSP4, which is a viral enterotoxin, trigger calcium dependent signal transduction pathway, which release vasoactive intestinal polypeptide and causes activation of the cyclic AMP. After activation of the cyclic AMP, it secretes more sodium chloride and water from the small intestine to the lumen. By this site, vasoactive intestinal polypeptide also trigger the chemoattractant factor center of the brain, which causes vomiting. Here, in short of the rotavirus pathogenesis, infection of the absorptive villus surface, reduce the absorption of the salt and water, stimulation of the enteric nervous system, reduce the disaccharide activity and reduce carbohydrate absorption, release enterotoxin, ultimately causes fluid secretion. All three mechanisms combinedly causes osmotic diarrhea. That is why patient develop dehydration and metabolic acidosis and even death. What is the clinical feature? Incubation period approximately 1 to 3 days. Abrupt onset of explosive diarrhea without blood and mucus. Vomiting and fever associated with abdominal cramp. Duration of illness 2 to 12 days. Even children present with diarrhea approximately 14 days. Children may develop dehydration, acidosis, shock and death, which one may I explained before. What is the laboratory diagnosis? How we will identify the rotavirus in the laboratory? Specimen should be stool and blood. Detection of the antigen within the stool and antibody within the blood. The method of antibody detection, ELISA and immunochromatographic test and latex agglutination test. PCR also done for genotyping detection. Electron microscopy also done only on research purpose, not diagnostic purpose. There is no specific treatment for the rotavirus infection, only supportive oral and IV rehydration therapy. Prevention must be done for the rotavirus infection. We also focused on the good sanitation and maintain hygiene, exclusive breastfeeding in case of less than 6 months of age children, and improve water quality. We should focus on the vaccination. What are the vaccine? There are 3 types of vaccine already present in the market: RotaShield, RotaTec and RotaRix. Among them, Rotashield and Rotarotec is now obsolete from the market. Rotarix now available. Rotashield was the first vaccine approved by FDA in 1998, but it is withdrawn in 1999 due to risks of intussusception. Rotatec, it had 3 doses at 2 months of age, 4 months of age and 6 months of age. Rotarix, it has 2 dose schedule. First dose should be administered at 6 weeks of age and must be completed within 24 weeks of age. This is at a glance of rotavirus. It is a contagious virus, symptom present with severe watery diarrhea, vomiting, fever. Transmission mainly occurred by fecal-oral route, enter in the mouth by contaminated hand, surface and object. Prevention can be done by vaccination. It is mainly oral vaccination. Now, enteric adenovirus, the second cause of viral gastroenteritis of the young children. It is a non-enveloped virus, mainly serotype 40 and 41 causes enteric gastroenteritis. Patient present with low grade fever, watery diarrhea followed by 1 to 2 days vomiting. Duration of illness 1 to 2 weeks. Most of the children develop antibody within 3 years of age. The human calicivirus, mainly norovirus. Recently its outbreak occurred in Texas and Canada. It mainly causes diarrhea in older children and adult. Non-enveloped single-stranded RNA virus. Virus surface has 32 cup-like depression. That is why this name is Calici. Patient present with severe projectile vomiting, diarrhea, abdominal cramp and low grade fever. Duration of illness less than 3 days. It is also a self-limiting viral disease. That is all about gastroenteritis, mainly viral gastroenteritis. Thank you all.